Hi, I was talking to a mother just now about how to manage coping with her crying baby and toddler. And we were having a conversation a way that babies and young kids communicate their needs by crying and develop their trust when their needs are met. As a parent at these times, it can be really hard to work out why your child is crying and frustrating when your attempts to satisfy their needs don't work and the crying continues. Babies and very young kids don't know how others may feel at the sound of their crying, and they know that if they need something, they cry in order to get their needs met. But as you would know, if you're parenting older kids, as our babies grow into their toddlers and our toddlers grow into their preschool age self, they cry less and they use their words and their body language to communicate their needs. If you're finding your babies or toddler crying a lot, and if you're finding it really, really hard to cope with this, it might be helpful to ask someone who has some experience with babies to help you. It might be a family member, it might be a friend, it might be a nurse, it might be your early childhood centre or a psychologist perhaps. But also you could get educated about caring for babies by reading lots of books and attending lots of courses. But the biggest thing for me would be to find ways to manage your negative feelings if the crying's too intense. So I was chatting to this mum today that she could put on her music, listen to a podcast or an audio book. And it's really okay to put your baby in a safe place like their cot and leave the room just to calm yourself down. You could use a sling or a baby Bjorn and get regular help to give yourself a break. Get as much sleep as you can. And I know some of you might laugh at that when you're parenting babies and toddlers, but absolutely trying to get enough sleep and trying to get your baby to get enough sleep. The big thing too is to manage our self-talk and really talk to yourself about being patient and staying calm. Change your expectations. Perhaps have another caregiver give Bubby a bottle or settle your little toddler at night. And if you need to hire help, if that's possible for you, go for it. Doesn't mean you failed. What essentially we need to do is get in control of the situation and be organised. Sleep when your bubby and toddler sleeps, eat well, drink well and exercise properly, because often our personal health goes out the window. So remember, the average crying time of babies at 6 weeks of age is 2 to 3 hours a day, and a very wide range of that is normal. So a certain amount of crying in babies and toddlers are to be expected. It seems that some little people are just more sensitive, and for some they're more colicky. For others they've got food intolerances and allergies. Some are suffering reflux, and some are just more needy, clingy, demanding or irritable little people that are going to need some more help to manage their emotional regulation. And I know I talk a lot about ways to support kids in managing their emotional regulation, whether it's in my books or in my online courses or even just in these YouTube clips. Anyway, thanks for following, for liking and sharing, and I'll see you again soon.